Titan Medical Incorporated presents SPORT, single-port orifice robotic technology in a demonstration of cautery, suturing, and knot tying. Using a bottle with a 25mm neck, SPORT is introduced into the bottle for the demonstration. After deploying the stereoscopic imaging module, the two interchangeable instruments are introduced through the insertion tube of SPORT. These instruments are controlled by the surgeon at the surgeon console to provide a full 7 degrees of freedom of movement for each arm of the robot. In this video, the right arm of SPORT is a hook cautery that can be used for dissection and hemostasis. Using the grasper on the left arm of SPORT to provide retraction, the cautery is used to precisely dissect or cut the tissue. Because of the dexterity of the arms, any part of the tissue could be incised or dissected from any angle to achieve the most precise dissection or deliver hemostasis with the most precision. Many types of surgical instruments are available on the robotic arms of the SPORT surgical system. The robotic arms can be easily exchanged during any surgical procedure so as to provide the appropriate tools for the surgeon as needed. Here, the hook cautery has been exchanged for a needle driver. The needle driver is used to tightly grasp the curved needle and then precisely push the needle through the tissue. The dexterity of the SPORT surgical system enables almost perfect passage of the needle with no collateral injury of the tissue. The dexterity of the arms makes it relatively easy for the surgeon to wrap the suture around the instrument twice and then reach around and grasp the end of the suture to pull it through the two loops to complete the first throw of the knot. Then the surgeon completes the second throw of the knot to create a square knot that will firmly hold the tissue together. Suturing and tying knots during any type of surgery requires the most dexterity and precision of any surgical task because the needle must be passed through the tissue in the exact curve of the needle to minimize trauma to the tissue, and because it requires grasping the end of the suture wherever it lies in the surgical field. A third knot adds security to the closure and demonstrates that even when the end of the suture moves, it is quick and easy for the surgeon to follow it, grasp it, and complete the knot. In this video, we have demonstrated three aspects of the superior functionality of the SPORT surgical system: the precise use of electrocautery, the relative ease with which a surgeon can tie knots, and the ease with which instruments may be exchanged during a surgical procedure.